Hello, everyone. Oh my gosh, and welcome to the first episode of Health Professions Fireside Chats. We're going to get things started right now, but I'm your host, Brian Park, and we'd like to thank everyone for tuning in today. With our country still fighting COVID-19, we wanted these Fireside Chats to highlight UVM faculty and affiliates working within health-related professions and to call attention to how those folks are contributing to the pandemic response. Later in the show, we will have a question and answer portion. At any point during the show, please submit any questions you have for our guests, and then we'll select a few to answer during that segment of the show. Also, one quick note for folks, because this is an online medium, expect to see a few delays between when questions are posed and when our guests share their answers. So without further ado, let's bring on our first guest. She is a clinical instructor at UVM with a focus on nursing education and medical surgical nursing. She enjoys mentoring nursing students by creating a positive, exciting, and compassionate supportive learning environments. And when she's away from work, she enjoys being outdoors and spending time with her family and rescue dog. So please welcome Kathleen Monforte. Kathleen, welcome. And to get us started, I'd like to know, how has COVID-19 impacted your work?
Thank you for having me here, and I'm excited to be here to talk to you all. So as a clinical instructor and a staff nurse in the hospital, I would have to say that COVID-19 has impacted my work in a way that I could have never imagined. When the pandemic emerged, there was still so much unknown about the virus, but as nursing educators, we knew we had to separate physically from our students. So the best way to do that was to transition to remote learning. So for myself and fellow faculty members at UVM, this transition from in-person learning to remote learning occurred in less than a week. So you can say we were stressed. I think everyone was stressed. So I was stressed, overwhelmed, uneasy, which I think are all feelings that everyone was feeling at this time. But I always kept going back to a saying that my mother used to tell me, and that was, you can't control what happens, but you can control how you react to it. So this became my mentality, and I had to remind myself on a daily basis of this. And for me, the key to this transition as an educator was to be open, honest, and transparent about the process to my students. Our students were vulnerable, anxious, and they had all rights to be. Excuse me, their world had turned upside down within days. In the classroom, I strived to establish a connection with my students, and I wanted to continue to maintain that connection, but I just had to do it in a different way, via Zoom, phone calls, Microsoft Teams, in a format like this. But as educators, we went into crisis mode, as everyone in the world did. And as we progressed through the days and the weeks of the semester, we were literally building a ship as we were sailing it, but the faculty and students all came together. And then, so that was kind of my perspective from the impact as a clinical instructor, but as a nurse, and as nurses do, we feel it is our duty to respond. And as a staff nurse, I felt the need to go to the front line and help, but I couldn't because I needed to be home with my 3-year-old and my 7-year-old. I became Teacher Monforte at home. I felt guilty about not being at the bedside taking care of patients, but I had to take care of my family. There were hard conversations I had to have with my husband, including, if we get to a point where I need to help, I have to go in. I have to be there. We talked about how I would possibly stay in a hotel and self-quarantine. These were all things that we talked about, but for other nurses that were on the front lines, these were real things that they were doing. They were isolating from their families for weeks so they could take care of others. So as nurses, we prepare for the worst, but hope for the best. We adapt and move forward, we rise to the occasion and meet the challenges. And we do this because we have an underlying passion to help others. But here's the thing, in the midst of COVID, and we are going to continue to be amid COVID for a while, this is our new norm. And I think the one piece that I can truly take away from how COVID affected my work as a nurse and a nurse educator is to allow yourself time to process. Reflect on the things we can't control, process them, and allow yourself time to do this. We have to, because if we aren't able to do this, we aren't able to move forward. As nurses, we don't allow ourselves to do this a lot, but we need to do it more. And so my goal as a clinical instructor is to pass this on to future nurses.
Thank you so much for, Kathleen, I loved your story, and I really appreciate the perspective you have around how nurses should be sort of looking forward to their work and to why they enter this work. And thank you for highlighting a really real conversation that must be happening in the homes of many professional nurses across the country. And on that note, I do understand that you had a personal connection to COVID. Is that correct?
Yes, that is. So I think we all know friends, families that have been affected by COVID. We all know some that have lost family members, friends, neighbors, but my personal connection has to do with, I did have a family member get sick during COVID. It was unrelated to the actual virus, but they had to go into the hospital during this time. And this person was my grandmother. So, and in the past, I've been a family member there for someone while they're in the hospital to be their advocate, but I've never been the family member of someone in the hospital during a global pandemic. It was just crazy, strange. It still is crazy and strange times. And it's something I don't wish on anyone. And so while I could communicate with her nurses on a daily basis, we couldn't visit her in the hospital. We couldn't be there with her until she was transitioned to hospice care, where she passed away. And I totally understand the reason why we're doing all this and why we couldn't be there in the beginning with her, but it left my family a sense of disconnect. And I never want my patients to have their family members feel what we felt as a family. So I think my big takeaway from the whole experience that we had is that I want to instill in others the importance of that connection that someone has with a friend, a family member, a loved one. And don't ever forget about that when you're caring for them, because it's so important and it's so vital. So that was my personal story during this pandemic.
Yeah, absolutely. It can be very difficult when a family member or anyone close to us passes, and it can be really hard to make meetings. So I'm really, again, very grateful for sharing your story.
Of course.
So thank you, Kathleen, and I'm looking forward to hearing more from you later in the show. And so for anyone in the audience listening, a quick reminder that you can submit any questions into the chat for our question and answer portion that's going to happen after our second guest. So please submit your questions as they come to you. With that being said, let's bring out our second guest. You may recognize her from UVM's front page, where she was the face of an article highlighting UVM offering early graduation for nursing students to help during the pandemic. She's a very recent graduate from UVM who starts working as a nurse at UVM Medical Center this month. And a bit of good news, yesterday she passed her NCLEX, which is fantastic. So please welcome Katherine Calisti. Katherine, thank you very much. And to get us started, will you please tell us what it was like to wrap up your studies as the pandemic was happening?
Hello. Thank you for having me. Thank you so much. And let me just start off by saying, couldn't have done it without Kathleen and her help. So she was my professor, Med-Surg 1, so thank you. But yeah, wrapping up, definitely bittersweet. It was hard to just end college in general. I think any college senior had a moment of grief and mourned a little bit from the months of March to May, definitely. It was difficult to not have what I considered at the time promises, like a graduation and a senior week. And then, you add on top being a nursing student, and it was just kind of odd. I mean, for me, I had a job at the end of college at the hospital. And, instead of dismissing me or letting me go prior to the start date, I was actually in high demand. A lot of friends at the time, unfortunately, weren't able to get jobs straight out of college or get let go. For me, one day I literally got an email and was told, that I'm graduating early on May 1st and possibly starting work early. With that, a lot of me and my classmates in the nursing program, I think, got a lot closer despite not being able to be with each other physically. There was a lot of common feeling and empathy among my classmates. Due to the pandemic, there was a lot of time of reflecting what graduating meant to me and being a nurse. Thankfully, my professors were probably the most understanding people. Maybe they were more understanding than they should have been, but they really just allowed time to complete assignments, no questions asked. They encouraged us to keep them updated with their own personal lives. They knew what stress we were going through, and they really allowed us to take the time we needed to reflect you know, in a weird way, I'm trying to be an opter, you know, be happy about it. And I tried my best to be almost thankful for this whole situation because it just really gave me time to reflect and thankfully, obviously, study for the boards. So, yeah.
Excellent. Yeah, thank you, Kathryn. Yeah, it probably wasn't easy. So when you've been thinking about this really strange time, this prominent time in our history, how did the experience sort of help you become a nurse or impact your view?
Yeah, great question. So my grandmother was a nurse. My mom just retired in October after 40 years of being a nurse. So again, this time just gave me a lot of time to talk with my mom and the nursing faculty and just reflect on what being a nurse means to me. You know, senior practicum was something that I thought a lot about during college, something that I really, really looked forward to. And for those that don't know, it's basically you're a student nurse, but you're also kind of on your own handling patients, working with a nurse side by side, getting your feet wet. I was going to do mine on Baird 6, which is the general surgical floor, the floor that I got hired on. And I thought I needed this experience. And unfortunately, because of COVID, I was unable to even do an hour at the hospital. And without this, I felt like I just lost skills and knowledge. However, I still graduated, still passed the boards. And now I realize that, you know, nursing is a lot more than just skills. I think back to my last Zoom lecture that we had, and it entailed alumni and faculty just surprising us. One of my professors even got in his regalia. They told us all advice from don't buy expensive scrubs to learn from your mistakes. And I can only compare it to family members telling us how proud they are of you. You know, they saw us at the very beginning. They saw something in me and my classmates that we didn't see in ourselves from the very beginning. And by the end of that Zoom, we all cried. And just like that, you know, I was welcomed into nursing, and I'm still feeling that embrace right now. So, yeah.
That's wonderful. And yeah, again, congratulations to your class. And I'm really hopeful that the same energy is being pushed to all, not just you, but also your classmates.
Yeah.
So thank you for sharing.
Yeah.
Absolutely. So so now's the time that we want to move to the question and answer portion of our show. So I do have one question from Sarah. That question, I'm going to ask Kathryn to answer it, then Kathleen, if that's all right. The question reads, what would be your advice to freshmen or first-year nursing students that are beginning their nursing education at UVM in the fall? So Kathryn, we'll go to you.
Yeah. First off, breathe. You got it. You know, it's funny. I remember being a first year and having a lot of more work than some of my friends were having. But, you know, I think sometimes UVM can feel like a big school, but nursing does such a good job and making it feel so much smaller. And you're not really involved with the nursing faculty. Your freshman year, you get kind of towards the end of your first year. But I would say go to Rowell, the second floor, knock on anyone's door. They all have their specialties. Get to know them. They'll know you. They'll know your name. I think I met Kathleen once or twice and she knew my name already. She would see me in the halls of Rowell and go, Kathryn. I'd go, hey, professor, I didn't know you knew me. How are you? Get to know them. They're there to help you. I saw it towards the end, how much they love us. So just get to know your faculty. You'll be fine. Breathe.
That's awesome. No, so I think my key advice for freshmen that are coming to UVM to study nursing would be kind of tailing on what Kathryn was saying, but not only breathe, but communicate. So introduce yourself to people. And I always tell people I know, nursing students, like, you never know who you're going to meet and you never know how they could be part of your life later on. So always communicate. Communication is key. And my other piece of advice is it's a lot of transition freshman year. It's a lot of getting used to just college life. But I urge you, you're going to be taking key classes like anatomy, physiology, microbiology. Pay attention and pay attention and take what you learn in those classes, and you are going to build your whole nursing career pretty much on that. And we're going to use that your third year, your fourth year, and the rest of your career. So my two main things I would give to freshmen are communication and pay attention in those key classes you take those first and second years.
Absolutely. Take notes, first years. This is all great. Good advice, y'all. So we have another question from an anonymous person. So that question reads, how do you think this pandemic will affect the nursing field in the future? I think I'll ask Kathleen this first, and then Kathryn, if you can go second. So Kathleen, please.
Sure. So this is a great question. I mean, I think just the pandemic in general is going to affect everything of how we go forward in our world today. But I think in nursing specifically, I think it's put a highlight on us. I mean, it is the year of the nurse as well, 2020. So, but I think it's really going to change nursing, and I'm not quite sure what that's going to look like, but there's definitely going to be change, whether it's, I mean, at the educational level, definitely, because if we've gone more towards and need to go more towards that online remote learning, as nurses, we're doers. We like to have hands-on. So how are we going to meet those challenges of still teaching nursing students with that mentality? So I think it'll definitely affect nursing in the future. Just not quite sure how, but I think it definitely will.
Yeah, I think it's tricky for me because I'm not quite there yet. I think the biggest takeaway from me, you know, I would tell people, oh, I'm a nursing student. And during this whole thing, they would thank me. They'd go, thank you so much. Wow, good for you. You rock. Thank you. And I was like, I mean, I haven't done much yet. I just open a book a couple of times a week, and, and not to say that, nurses need to be appreciated or, get our feet kissed every day. But I think this really opened up people's eyes to how every healthcare worker does, from a nurse to a doctor to LNA, LPN, everyone, yeah, that's all. Yeah.
Absolutely. Thank you. And so we have time for one more question. I think we have this question comes from Carol, I believe. Have you heard a story about a nursing colleague during this time that has really inspired you or made you particularly proud of being a nurse? And we'll end on this question. Let's start with Kathleen, and then we'll head to Kathryn.
Perfect. Great. No, I think as we all watch the news, we see our frontline workers being highlighted with great stories. And I think for me, it's my nursing colleagues. I spoke about earlier, I know nurses in the emergency room that are there frontline when all of this happened, and they had to leave their older children that were seniors in high school and go isolate themselves. So it was something that they knew they had to do for the greater good. I know other colleagues that have with nursing, we go with the flow. They unfortunately had to close down their part of the hospital, and they had to get trained in another part of the hospital. I know certain nurses that have gone to the front lines of the higher impacted cities like Boston, New York City. It's that passion to put others first. And definitely we have a lot of nursing colleagues out there that have done that.
Yeah, my class is incredible. The fact that I'm representing them is okay. They're incredible kids. A couple of them were LNAs before the pandemic hit. Pandemic hit, not only were they students, but they were COVID workers. They were LNAs. They did everything they could, already working at the hospital. I know a couple of my classmates working now at the VNA. Not only are they studying for their NCLEXs, but they're also emergency nurses with the VNA, going to these people's houses, working, learning, studying. And I mean, yeah, that's incredible to me. They're studying for the boards and they're being nurses at the same time. I mean, that's so inspiring to me. Yeah.
So it sounds challenging, but I'm sure they're up for the challenge. So I want to just I think we'll end there. I want to thank both Katherine Calisti and Kathleen Monforte for being our guests today, for taking time out of their busy schedules to share their thoughts and wisdom with our audience. So thank you both. Tune in on Wednesday, July 8th at 1 p.m. for our next episode with Dr. Cindy Noyes, an infectious disease specialist who co-leads the UVM Medical Center's preparations for the potential arrival of novel diseases like COVID, as well as Dr. Elizabeth Carson, a first-year resident and alum of the Larner College of Medicine, whose research project brought significant improvements to medical education at Larner. Until then, thanks for watching and stay safe and healthy.